First, what effect will the COVID vaccine have on the likelihood of getting pregnant and having a successful pregnancy? And second, what effect would COVID disease have on the likelihood of getting pregnant or having a successful pregnancy? So let's start with number one, the effect of the vaccine. Now, from looking at and studying thousands of women, we find the vaccine does not affect your likelihood of becoming pregnant. For women and for men, for that matter, the vaccine does not affect fertility at all. And once you do become pregnant, the vaccine itself also does not affect outcomes of pregnancy. Again, looking at thousands of pregnant women, when comparing those who were vaccinated to those who were not, those vaccinated did not have worse outcomes in pregnancy, particularly when looking at rates of miscarriage. The bottom line is that the vaccine is safe, whether you're planning to become pregnant or you're already pregnant. But then we have to go to question two. How does COVID disease affect fertility and the likelihood of a successful pregnancy? Now, on the first note, a woman's fertility does not seem to be affected necessarily by COVID illness, but the same is not true for men. COVID infection was found to decrease a man's fertility, at least in the short term of a couple months. And when you do become pregnant, the story changes. In multiple studies looking at thousands and thousands of women, those who tested positive for COVID had an increased risk of many poor outcomes. Far too numerous to list here, but they include preeclampsia, early delivery, postpartum bleeding, blood clots, and fetal distress.